Hi, welcome to the Fit Mommy Nation TV. Now, in this first few series of interviews, I hope to share with you the amazing stories of fit mamas in Singapore who embrace healthy and active motherhoods. Now, these amazing women have been through the ups and downs of motherhood, and they have seen their fair share of challenges as they navigate mom life along with achieving their health goals. There's so much to share, to learn, and to be inspired by each of their stories. Today, I have the privilege of inviting Dr. Cheryl Kam on the show. Dr. Cheryl is mom to 2 children, and she's expecting number 3 in a couple of months' time. You know what? I feel so small writing out Dr. Cheryl's intro because I do not want to undermine her credentials. You know, she graduated from medicine school at the King's College of London, and she holds a Bachelor of Science from the Imperial Business School. After 15 years of practicing as a family physician, she left conventional clinic work to pursue her passion in human development, which is helping more people through functional medicine. And so she went on to complete integrative and functional medicine fellowship with the Australasian College of Nutritional and Environmental Medicine. And she also studied advanced nutrient therapy and brain biochemistry with the Walsh Research Institute in Chicago. Now you know why I get so blown away just by typing out her credentials. I'm so thankful for this conversation as we chatted about how conventional medicine may fall short in supporting people who are suffering from subpar health. And we also talked about kids' immunity and also the top 5 nutrients that all women, especially moms, must not overlook. There's so much to share, so much to learn. 1 hour is not enough. But I will not reveal much for now. Let's get right into the conversation and start learning from Dr. Cheryl. All right. Hello. Welcome, Dr. Cheryl. Thank you for taking time to join our show today.
Thanks for inviting me. I am thrilled to be here to share what I know. Hopefully it's helpful.
I know you're a busy mom too. Yes. So, I mean, I think you'd be the best person to, say what you do or introduce yourself. So I'll not take the show from you. I'll let you have the spot and, just let everyone know what you do and who you are and how many kids do you have?
Yeah. All right. So, I'll talk about my profession first. I started off as a family physician, but actually now I'm what they call a functional medicine practitioner, functional medicine doctor. I practice integrative medicine, and I look at people who have health issues who maybe are not so satisfied with the conventional offerings. They are sub-health. And they've come through many specialists and doctors, and they haven't been able to clear their eczema or their thyroid problem or their autoimmunity. Prenatal and postnatal is a real passion of mine as well, because I feel that that's how we can create better babies and better families as well. And it really starts from preconception. So that's a passion area of mine. And of course, it gets into very tricky areas as well, like long-term gut health and IBS, multiple sclerosis, brain inflammation conditions, things like that. And of course, there's great interest in the microbiome lately. So there are all these topics, big topics that I'm passionate in, and I've been seeing patients for over 15 years already. And what I actually really do now is that while I see some clients one-on-one, my passion is actually in teaching more and more personal trainers, those in the wellness and fitness industry, health leaders, and even self-healers, and doctors as well. There are some doctors in my course, to apply a systematic manner in seeing these suboptimal health conditions. And there are a lot. There is just, there are a lot of us who don't fall into necessarily diagnostic categories, but we're walking around tired, lack of energy, losing hair, lack of motivation, those type of things. We always end up finding true causes of them through the lens of nutrition, through the lens of environmental medicine as well. So that's my passion area. That's what I do. You can always surf onto my website to find out more. Personally, what brought me here is the fact that I had burnt out as a doctor, and it's very, very common in the this profession as well, in the caring profession, to burn out. And I did that. I like burnt out and made pretty poor decisions several times in my life in the last decade. And of course, conventional medicine like antidepressants, anti-anxiety medication, sleep medication, you know, was not a choice. Like it just wasn't the way I wanted to go down to treat
I mean,
myself.
how long were you did you experience that, like, burnout?
Well, several times. So, I mean, I have, um, pretty tricky childhood. And I think that also meant that my teenage years were always very angsty, but somehow I made it through medical school, but definitely burnt out very quickly after graduating because the demands of the job are quite high. And recovered from that through, simple self-care and just waking up and things like that. But I also realized that burnout, and I do specialize also in burnout recovery, in that there are so many layers to getting well from burnout, and it really doesn't just take 2 weeks of a quick fix. It actually is a really, really deep. It goes deeper than that. So it starts from physical, because by the time it affects your physical body, you are very nutrient depleted and your hormones are out of whack. And probably you will have some symptoms that medically will be recognized.
Right.
So I would treat that with a client, but we would use the momentum and carry on and say, ask the question, now that you're well, after 3 months or 6 months of work, what got you here? How did this happen? What happened? And we'd go into
And
the
you work on that.
lifestyle, the diet, and this and that, and the mindset and everything. And it really goes deep, and that's very, very rewarding. And that's also why I've come out of the clinic and I do it in a coaching relationship. I happen to be a trained doctor, yes, but we kind of look at the whole life rather than just a physical body.
I guess it's also a function of, how much time a conventional doctor has in the clinic for a particular patient. Is that one of the, key factors? It's hard for a conventional doctor to practice in this manner.
Unless you know what you want to do and you sculpt your practice accordingly. I was depressed, had chronic eczema that I couldn't shift, and my periods were definitely not regular at all. So terrible skin, poor immunity, getting cold sores and verrucas very often, things like that. That I would have, and you wouldn't say that I was sick in hospital, but it was really like sub-hell, right? And at that point, my energy was so low, I don't think I was treating my patients right either. So patients would come to a doctor thinking that they should be the picture of health, and I certainly wasn't, demonstrating that at all. And I said, okay,
but they can't see it, right? Because these were symptoms that people don't see.
They may or may not, right? So if you are, aware, a lot of us have met doctors who are tired, and you can tell that they are tired and they are rushed, and they are never going to be able to give you the 110% attention and therefore create a healing space for you, because they themselves are so burnt out and tired. And that seemed to be the norm. And I did not want that to be the norm at all for the medical industry at all.
So what was the trigger that got you to decide, okay, I'm going to do things differently as a doctor now? And then what did you do then?
I was always thankful for my mom. She was always a little bit of a biohacker, and she used to hang out at Nature's Farm when I was young. And she used to give us supplements. So I already knew something about supplements, and I already knew something about taking responsibility for your health, apart from relying on the main medical system and apart from relying on doctors to do it. along with the fact that I graduated out of medical school and realized that there was no nutrition training at all. And that didn't make sense to me. Like, how can you be a doctor and want to heal someone, not understand what somebody is eating or their environment or the things that are making them sick, and just selling the drugs that you sell?
Yeah,
So
yeah.
it didn't feel right to me, and I made the move. And I realized that luckily at this point in history, like, in the millennial times, the work of functional medicine, environmental medicine, nutritional medicine is pretty established, and there are colleges to learn from. So I pursued a fellowship, the basically the most advanced course of study for this area,
Mm-hmm.
and I did that
Mm.
alongside having my kids and getting married and stuff like that. So to answer your question, I'm expecting my number 3 in a month. So I'm
Yes,
very
she
excited.
is.
Yeah.
Number 3 on the way.
So yeah, I mean, cut a long story short, I mean, like, started healing from the inside out, and that includes physical, mental, emotional, spiritual,
Yes,
everything. For me, there is no boundary between them at all.
yes, yeah. So tell
Luckily,
us something about your kids first, since we're on your
yeah,
kids.
yeah. Go on.
Yeah. So how old's
I've
brother?
got a 4-year-old boy, Nathaniel, and a 2-year-old girl, almost 2, Amelia. She'll be 2 when the baby is due. So I hope the baby comes a little bit later so we can really celebrate her
Celebrate her
birthday.
birthday.
Yeah.
Right, right, right.
So that'll be
And
nice.
did you plan for them to be like 2 years apart exactly?
They're about right. Yeah, it actually started. It actually just it wasn't like a upfront plan, but it was sort of, let's just take it one step at a time and see how well I feel postnatal, right? I
Yes,
think you might
yes.
have that, Karine, as well. Like, I just took it one step at a time and say, okay, at about 18 months, 2 years after the first one, then I felt well. Maybe at that time I knew a bit less of what I know now, and then it took me really about 18 months before I really felt well again, and to like try and to put my body.
It is right, about 18 months. And
Yeah,
then we think about the 4 months maternity, and then you got to
and then
pop
you
the woman straight
exercise.
back to the workplace. Actually,
No,
it's,
and then
it's, it's really
exercise
rough.
as well, because as you're breastfeeding, the relaxin hormone is still there, so it's still, you still considered postnatal, I think, until 2 years
two
after
years,
that.
yes.
Yeah,
Yeah,
I would say so,
almost,
physically.
almost.
So then we decided to try for my second, and we're very blessed. We've not had major struggle with fertility. I think it also helps that I know what to do, and this and that. But after my second one, I definitely knew a lot more than I did with my first. And after a year already, I was like, oh, I feel great now. I feel like,
Right,
I
right,
felt how
right.
I did 2 years after the first one. Um, so then we decided to also try, and there we go. Like, I think no, I was breastfeeding, and I hadn't really had any cycles. But we're like, oh yeah, let's just have some fun, and then fell pregnant. So I think we're really, really blessed in that sense. Like, I mean, I must give credit to myself as well, of course, that
Of course,
do.
of course,
We have
yes.
been cleaning up our diet. I have been removing toxins even from inside my mouth with the amalgams, and looking at the environment as well. So and keeping up with nutrition. So
My journey as a fitness professional, I have spoken to a few, and I mean, I love to learn from every single one of them. But honestly, like, for a mom on the, like, the everyday mom walking on the road, when you sometimes you tell them about these people, they're like, who are these people? Right? They only know
yeah,
they only know the GP. But so then maybe you can help to break it up and, like, make a definition a little bit clearer for us. Like, what's the
yeah,
difference between a nutritionist,
I will
a
try.
dietitian, a naturopath, and then a
Okay.
functional medicine doctor?
Oh gosh. Okay. So let's start with just a few things. Functional medicine doctor versus doctor, maybe first. So obviously, we've talked about this, how my journey towards from conventional medicine, I wanted to heal people, and I really My question actually, I mean, my passion is actually in human development, and I really want to develop a person to their full potential. Okay. And all of us moms want to as well for our children.
Our children,
Children
yes.
come around. So that was my perspective. And my question was not being answered even after I graduated. And I was like, wait a minute, this is a little bit of mismatch. So I decided to do postgraduate training and realized that nutritional training and understanding about the environment did not come with my medical degree. This is a postgraduate thing. So
Right.
I then pursued, it was like 4 years of further study and also a
On
lot
top
of
of medical school,
on
right?
top of medical school. And this is the way things are. Obviously, the ideal is that you learn these things in medical school, but I think that there's too much technical data that needs to be covered in 5 years of medical school that maybe it's not included. Fine. So I did that. And this piece of information should also make you realize that doctors who graduate with just a basic degree without nutrition and without their postgraduate interest in environmental medicine and functional medicine have a level of understanding of nutrition. I mean, I've definitely heard doctors and oncologists, cancer doctors and hormone doctors all saying, that your diet has got nothing to do with your disease. So this doesn't make sense at all. And all you have to do is talk to a traditional Chinese medicine doctor, and you will understand. And they will also have a deep understanding of nutrition, herbs, our environment, and this and that, and the qi system. And so I felt like I was a little bit more on the philosophy of a Chinese medicine doctor in a certain way. But I just happened to have a conventional degree. So I kind of like went into this direction. And in America, the term functional medicine is a marketed term because of the big college that gives training for functional medicine for doctors who want to become functional medicine doctors. But there were so many other names for it before the U.S. college got did their marketing. We were called like integrative doctors,
Right. Right.
complementary, nutritional medicine. There's so many names for it. So when you come across a functional medicine doctor, like say me, I've got, then you look at my credentials and you'll say, okay, I've trained in this, that, and I have such and such a philosophy. When you meet another functional medicine doctor, they might have different
Philosophy.
training, different approach, different everything. But roughly, that they are treating things a little bit more at the root. They're going upstream. They're looking at the whole picture a little bit better. The approach is different. It's not so much to diagnose, but it's more to let's get to the root of this and help you to clear this forever. And hopefully you can save your money on long-term medication, and you can save thousands and thousands of dollars on ill health and stroke and Alzheimer's and stuff like that further along
Yes.
the line. So it's actually quite expensive to do upfront, but you would consider it a investment, I would say.
Yeah.
At the moment, it is expensive, and I definitely feel like more and more people like I want to. This is my mission. I mean, I want to improve how doctors and coaches serve by incorporating functional medicine into their existing skill set. So I went to go and do the fellowship and things like that. But actually, this information, a lot of it can be brought down to
Right size for the
yes,
different practitioners. Right.
absolutely. So
Right.
that the regular GP will have some idea on that. But I, of course, as a doctor, to change mindset is quite difficult. So a lot of my courses are actually geared at self-healers, at people who are seeking health, um, and people who are in the coaching and fitness industry as well. So there are much more of them. They're much more curious and much more hungry for the courses. So, I offer the courses to them. And when they then work with their doctors, the doctors become curious. And then that's how I get doctors coming to approach me as well for further training.
Yeah, that's why I guess I mean for doctors, because I think day in, day out, that's how they practice. It's a right, it's just a habitual thing. But when the patient asks for it and questions, so it
Yes,
becomes a ground up approach like, okay,
it's
I
a
better
ground up
go.
approach. Yes.
One patient asks, three patients ask, five patients ask, this
Like,
doctor
oh, I
better,
really should
better
go and
start
train
thinking
about
about
this.
it.
Yes,
Yes.
absolutely. You're so
The ground
right.
up approach,
So
right?
I
Yeah.
decided to do the ground up approach because converting doctors, it was not easy. I mean, I myself was observing what integrative medicine was, whether it worked, whether it was just selling snake oil. I was observing my other mentors as well, and very skeptical for 2 years, or more. Very, very
Yeah, yeah,
skeptical.
yeah.
Yeah. And I was like, definitely I was a naysayer. I was like, oh, multivitamins don't work and vitamins don't work. And I did, I came from that background. So I have been the person who said that before, but now I've flipped 180 degrees saying, wow, you know what? There was so much ignorance there. So
Then we bring in the so that's functional medicine doctor,
yes,
comparing doctors. Then
the
we bring in the
naturopath.
naturopath.
Naturopaths and functional medicine doctors are very similar in a way.
So they've gone
Very,
through
very
med school
similar.
as
There's a
well.
lot of naturopaths have not been through medical school, but they go to naturopathic college.
Right,
They
right, right.
learn all the things that make them a very good primary care physician, meaning that the first person that you see when you have a cough, cold, and this and that, and then they have other knowledge on herbs and things. So it's pretty. I mean, once upon a time, if you asked me, I would have happily gone to naturopathic college, I think. I may have told you, oh, like maybe I should have gone to naturopathic college. So it's that similar. It's very, very similar. So naturopaths will kind of look at functional medicine and go, oh, actually, we've learned a lot of that in our undergraduate degree already. Yeah, the naturopaths naturally have a bit of a maybe an underlying approach, but again, there's like naturopaths and there's naturopaths. There's good ones, there's bad ones. There's like just like in doctors with doctors as well, you got good and bad ones. So I think it's
Well, it's like oh yeah, I'm an Italian chef, and then there are like 300 Italian chefs on the street, and then, but they
yeah.
all practice differently, right?
Yeah, absolutely. So I think the important thing and the beauty of that is that as a consumer, you get to um, work with who you resonate with. So that's one. And also, I think it's important to realize that yeah, doctors are there, and we must kind of really be appreciative of the medical industry because of all the technical skills that they provide us in the emergency, but also take responsibility for the fact that if you want to prevent emergencies, you may have to work on your health independently with somebody who can do that with you. So
Yes.
then the people who empowered will work with naturopaths. They will work with functional medicine doctors as well to get under the health so that they don't even get into hospital and so that they don't even need medication in the first place. But if they do,
Yeah.
then the doctors are there to service them.
Yeah.
Yeah. And for
Exactly.
me, obviously, I happen to be a doctor as well. So, you know,
Yeah.
I kind of have the both.
I understand what's going on both sides. Yes. Yes.
Yeah, that's right. So yeah, I mean, hopefully one day, when you go into a conventional doctor GP clinic, the GP will understand about the basic nutrients and the GP will take you seriously on the diet and be able to work with your nutritionist, for example, and understand that each play a part in your health. With kids, they respond very, very well to nutrition. It's better to give them great food rather than supplements. With adults and moms and prenatal and, this sort of age group where you're about 35, 40, a lot of times there is already a nutrient debt. So, I mean, to answer a question that you'd asked me before as well, like the big problems that a lot of moms face is that for all our lives, we haven't really been eating that well. There's a lot of processed food in our food chain. And there's a lot of very low nutrient food in our food chain because our soil is all farmed. Um, so when you get to the reproductive age, you're already kind of quite low. You're producing babies who maybe already are born with nutrient deficiencies, but are coping and they look normal and everything like that. But all you have clues of are, colicky or allergies or behavioral issues, problem sleeping, little things like that have become the norm when actually it's nutrient debt that we're talking about. And when moms don't recover after the first child, then you get persistent issues with the second and the third, and maybe even like secondary infertility, meaning problems actually
Yeah.
conceiving, because by that time the nutrient has already up down that reproduction is a last priority.
Yeah.
That is really like the biggest issue that can be solved with education and awareness.
Mm.
Yeah. Yeah.
Yeah, absolutely. And the most interesting thing, one of the interesting things, women, as women, sometimes we don't even know what's happening to our own bodies ourselves,
Yes,
right?
and then you go for a health screen, and the health screen says that everything is okay, and you think that everything is really okay, and then when I look at these health screen reports, it's not complete. It's overdone in certain ways. Like, you always have this menu of cancer markers and things like that, which I really don't
Yes.
agree with. But you haven't checked the important things, the most common
The
nutrient
E's, the
deficiency in
D's, yeah.
Singaporean woman: vitamin D, iron, and zinc. So, I have courses that teach doctors and health seekers as well how to do the test, how to read it properly. Yeah, so I'm really glad. I've been there about like 120 people who have joined the course already so far, and they all really enjoyed it, really enjoyed the stuff. And also doctors have been able to use that information to also apply in their clinics as well to good effect. So there are top
I mean,
five nutrient deficits to do, and they're very
that's
easy.
awesome.
You don't need complex functional medicine testing. These tests are available routinely in the
From
doctor.
the labs, right? I've seen like lots of many moms walking into a clinic, or coming to you for consult. So
Yeah.
what would you say is also what's the biggest, like most obvious thing that you see common among all mothers?
Um, so we've got the five nutrient deficiencies, right? Out of the five, I would say that there's gonna be one that it stands out the most, and that's gonna be iron.
Yeah.
Unfortunately, iron is so poorly tested and very poorly interpreted as well by doctors. So you, even after identifying that you want to check your iron levels, it is sometimes not good enough to go to doctor and say, "Hey, can I have my iron levels checked?" Because your doctor may not know that to find out the true level of your iron, you actually need five tests.
Right.
And those five tests do not include iron levels. Okay, so your iron levels in your bloodstream is always kept constant, even though you are very iron deficient. So it will not reveal iron deficiency unless you've been going on with iron deficiency for 10 years. You've been losing your hair and probably low fertility as well. So the medical profession and the lab ranges are very good at catching when you are almost dying. But we must recognize that there is a growing and increasing number of people who are experiencing subhealth
Yes. Yes.
and subfertility. There are people who have come to me after their rounds of IVF, having never had their iron addressed properly. And I find it such a shame
Right.
because we spent a lot of money, effort, time, emotion on the whole process, not knowing that you actually lacked a major nutrient for conception and ovulation. So
Mm.
that is the number one issue. And I work with the Iron Clinic in Singapore to address this and to encourage people to get their iron tested. So for mommies, especially who have been menstruating all their lives and who have had babies, I definitely, and there are a lot of babies. There are just too many children who are born iron deficient. So they do not
Oh,
reach their
yes, yes. So,
developmental.
so is it true that with every birth, mom actually depletes more iron?
Unless you're able to replace it. If you're good with your iron levels during each pregnancy, your baby will take 1,000 milligram of iron from you, and then after that, after pregnancy, you do
Top
confinement
it
and
up
you
again.
build up your levels. But a lot of people don't, and also veganism is on trend now, and eating less meat is on trend. So it becomes very, very difficult even to. Also, when you're low in iron, your absorptive abilities are poorer. So it's a catch-22 situation where you are low in iron, but you're also not able to absorb anymore.
That's an
Um,
interesting one
yeah.
when you raise up veganism.
Yes.
Oh my God, that's another topic of discussion. But
Yeah. So there's that. There's definitely a way to be plant-based. but nutrient dense. And there are people who have done it. I only, as a practitioner, I will only see the people who come into problems. But there is a way to do it. Unfortunately, the way to do it involves taking synthetic supplements.
Mm.
Yeah, because biologically we are cavemen and and we are omnivores biologically. From an earth sustainability point of view, it definitely is better to go plant-based, but I don't think that it needs to be so extreme because we obviously need to survive as a species as well. And to survive as a species, we need to understand.
Survive well also is the key word, I think.
Right.
Survive
Yeah.
well. You don't want just to be like,
We live in a very interesting time where where animals are bred so that they are very inflammatory. So when you take out animal products, you definitely have less inflammation
check
in
out
your
inflammation.
body.
Yes.
But it doesn't mean that eating animals is bad. It's eating modern raised agriculture that's bad. So we're stuck in another catch-22 where we're supposed to eat meat and dairy and chicken and things like that, but the way that the animals
The
are
way they have
raised
been
is so
raised, yeah.
unhealthy that actually, yes, we kind of actually should limit it as well. So we're stuck. We're like, we should eat meat, but we should limit it. And the way that they are raised are also not very green. And so, yeah, it's very water intensive, and deforestation and these kind of things are really big concerns as well. So I really like Dr. Hyman's work in pharmacy. And I like also Dr. Zach Bush, who is into regenerative
Dr. Zach,
farming
yeah.
as well. So I think that those things, the more awareness, the more we can support those causes, I think will regenerate our soil and our earth, and they have everything to do with how well our children and grandchildren survive and procreate. So even if we're fertile now, like for me, I feel like, oh, I'm so blessed fertile, but it doesn't mean that my children are not going to have fertility issues because they were born from me and there's plastic in my placenta. I know that because it's been shown in the studies that people find microplastic in the placenta.
Yes, yes.
So yeah, like this lifetime, I think we need to turn into a little bit more like longer term thinkers. But back to your question,
Iron.
nutrient is iron. If you follow me or just like DM me on Instagram, which is the best place to look for me, obviously I've got a website as well. I would absolutely want to point you into the right resources, and I have freebies also on my Instagram about how to get your vitamin D up properly, what is the optimal range, not just the regular lab range, and
as a doctor, when a postpartum mommy walks into your clinic or arranges for a consult and comes to see you, what is the first important thing you personally want to watch out and catch for?
My goodness, that's the hardest question because obviously, as when you, with all the background training, when you look at someone, you're already assessing about 10 or 12 or 20 different things at the same
It's
time.
like a AI show, or like Sherlock Holmes, right?
Yeah.
It's like, he
There's
knows
already
names
like a
and
billion
what.
things going on in your head about what, postpartum and menopause is. But for me, yes. But the way I teach is to, again, look at their nutrient status. There are some clues in the physical that can help you, but if you can run some tests, then I would run those tests and have a look at first their nutrient status because it's just so common. I mean, 90% of women prenatal, pregnancy, postpartum, whatever, just women all across the board, even in a developed country like ours, is lacking in one of these 5 nutrients.
Mm.
Okay. Yeah. So iron, zinc, magnesium, D. And I also teach I also teach my practitioners how to calculate a zinc and copper balance because that has a great impact on mental health. And postnatal depression literally is an imbalance of zinc and copper.
Right. Yes.
100%.
Yes.
So when you can sort that out, you literally avoid them having to stop breastfeeding and having to take their antidepressants. Postnatal depression is not fun. It affects their bonding. It affects, maybe it will have, it will play out throughout the life of the child and the mom, and even impact on the mom's
Mental well-being.
learning to have more children, and then they have to stop the breastfeeding because they're on pharmaceutical medications. It's horrible. So if you can sort it out by simply addressing the nutrients and giving them the nutrients that they lack, how beautiful and elegant is that? That
Yes.
you really transform somebody's life. So
How long would you say it would take for the bloods and the results to surface? Like, like
Okay,
someone
so
or
in
like
Singapore, we have one lab now because the two major labs have merged. So it takes about 2 weeks for some of these tests to come back, especially the zinc and copper. But for iron, it takes like 2 days or even like the day itself.
Mm-hmm.
Yeah, not iron, but I actually recommend testing the ferritin levels along with a few other things. Yeah, so when you're doing a whole nutrition profile, I would usually leave it for about 2 weeks. And when you're replacing, you will see a difference within 2 weeks as well. But
Mm.
the full kind of replacement really takes about 3 months. I mean, the body takes some time to assimilate things. And then you can see a difference already within like 2 months. But postnatal depression is correctable within 2 weeks.
Right.
Yeah.
Yeah, so because I'm just thinking on the timeline issue, right? Because so say someone has an issue with breastfeeding,
Mm.
like challenge, and then like she comes and she tells you about this challenge, and then you put her up for send her bloods to the labs for test, but it takes about 2 weeks to understand. Do you already prior to that, up her level, up her intake, or you wait for 2 weeks for the lab test? Because it's
Breastfeeding
2 weeks
issues are not
wait,
just
and
an
then
intestinal
then you need to
issue.
take some time for whatever supplementary intake to take effect.
Yeah.
By then it would have been a long time for a newborn. That's crucial.
Yes. So that's why prenatal and care during the pregnancy is very important, because by the time you're having problems postnatally, it does take time to get it right. You don't want to supplement with something that you might have to then ask the patient to buy a bottle of something, which is the wrong dose, and they'll have to buy another bottle of something, which is the correct dose.
Right. So
So,
prenatally, so ideally, they should get their levels checked
yeah,
prenatally
and
so
obviously
that they
breastfeeding
prep
issue.
for postnatal, right?
Yeah, and for me, when it's a breastfeeding issue, it need not necessarily be a nutrient issue. So at the same time, if you're running the bloods, then you would also talk about latch or refer them to a lactation consultant or somebody who is a postnatal doula, or at least to talk about those issues if you're not comfortable with talking about them as a practitioner. If I wasn't comfortable with talking about them as a practitioner, but usually the breastfeeding issue could be anything,
Yes.
it could be anything. So it really is a good history taking and a good understanding of what actually the problem is.
Yes,
Yeah,
yes.
yeah, it may
Right.
not be the nutrients. Yeah.
May not be. Okay. Wow,
Mm.
that's like really so much stuff going on just for women.
Yeah, that's right. But I mean, the thing is, if you start from somewhere, you methodically go through it, you'll end up solving your problem. And that's how I teach. Like, sort of, I always start with the nutrients first. And then when people kind of carry on learning, then we have a step-by-step fashion in which to problem solve so that it's never overwhelming for the patient and it's never overwhelming for the coach or the doctor or the practitioner that's taking care of them as well, because you can kind of like just go step by step and have the
Okay.
solutions and give them the solutions as well. Yeah. The vitamin D thing and the government giving away free vitamin D pills to the elderly. Well, a lot of elderly are very D deficient, so 800 IU in those pills are not gonna touch anything at all. Yeah.
Right.
So it ends up being a little bit of waste. They also, the elderly will also have a lot of um, cofactors being deficient as well. For example, if you're deficient in magnesium, it will impair your absorption of the vitamin D as well. So not understanding those means that you waste effort, and there's a lot of waste.
Wastage of resources. Yeah.
Waste of resources. Is this really going to translate into better immunity? This tiny, dose. Don't know. Yeah. So
It's
it's still a step forward in a way that they understand that vitamins are important. I think, and I celebrate that. But there is a lot more to that. There really is a lot
Just
more
giving
to
out
it.
the pills, right?
Yeah, it's really a lot more to it.
You mentioned earlier that it takes about technically for a postpartum woman to really heal both physically, mentally, and everything. It takes maybe probably up to 2 years. Right. So for you personally, was exercise a part of your regime in, getting back, into being mobile or, feeling yourself again?
Yes, absolutely. But I was also very aware that it was going to be low impact. So one thing that worked for me, I really loved yoga, but I had back pain and I'm very hyperextendable as well. So in the end, after doing yoga, having done it for like 5, 10 years, my back pain was still there. So I decided to try something different, tried Pilates. After my first one was born, and I truly feel, this is my anecdotal report, that I recovered a lot quicker postnatally as well, having done Pilates for my second than my first. Yeah.
Yes.
So I really did it up until the last minute before delivery. And then, I started up maybe a 1 month afterwards as well, because you can do it very lightly. Strength training need not be vigorous, and it need not be high impact either. But you building up core muscle coordination and things like that, and that really, really helped me. People were like astounded how quickly I kind of like went back to shape. Not that that was a big priority, and not that it should be a big priority. But not just shape. Internally, I also felt strong, and I also
Yeah.
felt less wobbly in a way, because your hips are just changing size like this and this. So throughout the
Yes.
pregnancy, also I felt less unstable. Yeah.
Yeah. Yeah.
So
Exactly.
Pilates was the only really thing, and when walking, but I didn't go into anything else until I think about a year after or something like that. I decided to get back into football, which I enjoy, and I enjoy climbing as well. Like
You do.
yeah,
Wait. You mean football, soccer, or American football?
not American football, but soccer. Yeah, like like the cage soccer.
Oh, right,
Yeah,
right. Who do you play
so
with?
some girls, some women.
Some moms?
Yeah, some of them are moms, yeah, and some of them are like new graduates, interns, like a huge age group. Yeah.
Right. So you had
Yeah.
been playing since you were young, or?
I played at university, so we had teams and intercollegiate competitions and stuff like that. And then after that is more like, now it's like just a hobby,
Leisure
and
play, right? Yeah.
really just a reason to run. Yeah,
It
yeah.
is good. It is good. Meeting other women, having fun,
Yeah, but
community.
like now, I'm a mom of young 3 kids, so I've been pregnant a lot. So I've really not been part of the group that much. But if anyone is interested in cage football and 5-a-side, or sometimes we do go 11-a-side as well, then just ping me a message and I'll like kind of lead you down, because it's not easy to find a girls group with
Who play, right?
play, and then also we've got a coach.
Kids earlier on, I think every mom here would love to know. It's always on the top of our heads, right? What would be your top tip for boosting a kid's immunity
It's the
so that they don't have to stay home,
same thing. Yes, it's the same thing. All
Yeah.
right, so I'll just give you a quick and dirty tip. A lot of people think it's vitamin C. It's not. It's actually zinc. So I like this supplement called Immune Ped, which you can find, I think, you can find in doctors' offices, and you can find it like Thompson Medical, like pharmacy. IMMUNPED. It contains a very absorbable form of zinc, which you want to give your kid the minute you think that they're falling ill. However, to prevent that from even happening, then you have to attend my course on the 5 nutrients for yourself. Because when you're doing that for yourself, one of the lectures also includes food-based things to do. So you need to supplement if you're already in like nutrient debt, sure. But how do you maintain afterwards? Definitely, we talk about the diet, and that if you implement for yourself, then you're probably implementing for your family, and so your husband and your kids are going to benefit from these nutrients as well. So the 5 nutrients that are most lacking in women are actually the 5 nutrients that are most lacking in children as well.
Right.
So
would you say so? It's the same for men?
For men, a little bit different because men don't menstruate, so they're usually okay with their iron content. But yeah, I do find a few. So there are differences in men. However, if you're eating a whole food diet and you're having a iron-rich diet, they're not gonna, suffer from
fall
that.
too far off, right? Yeah,
for sure. So this is great for people who are trying to recover their health. It's the first step. For doctors and coaches who are practicing and you want to learn about hormones and gut, but you don't know about the nutrients, I think you're missing a very important piece.
Yeah, and also for kids, I mean, these days there's so much talk about the microbiome.
Yes.
I mean, I have like the microbiome book from Dr. Cheryl and a couple of other books. So I mean, so much talk about the microbiome and how it affects our guts, and then gut health leads to everything. So then for the kids, would you say that really letting them get dirty, it's absolutely fine?
Yeah, I think that the kids are definitely too clean, but the problem with our dirt these days is also contaminated with chemicals. So if you go onto the soil and everything, it probably has anti-mosquito and it has pesticides on it as well.
Right.
So you must probably keep a balance of that. So for me, I like to bring my kids to the beach where there's free-flowing water and sand and air, and they're grounding as well to encourage the detox abilities.
Yes.
And we're not too fussy on dirt either, and we don't use sanitary. No, we don't use what do you call that, like the alcohol.
Hand sanitizers, right?
Yeah, we don't use that as much, but obviously we in public places now you kind of like have to and all. So that's really important, and obviously the microbiome in the mom gets translated down into the child. So aiming for, again, vaginal delivery is one of the best things that you can do to seed the microbiome, and persisting with breastfeeding as much as you can as well is one of the other ways that the mom's microbiome gets passed down to the child as well. But we also must realize that our own microbiome in this generation, half a decade from the Industrial Revolution, is already altered.
Compromised.
When you've had antibiotics, it's compromised for at least 6 months. And if you don't work on it, it's compromised for life. It's just changed completely for life. And so a lot of us have already a very altered microbiome, and it's really not as simple as taking a probiotic.
Right.
In a lot of cases the probiotics don't stick because there are not any prebiotics to feed the probiotics with.
Probiotics,
wow.
Yes.
So a lot of people are lacking in their fiber intake for sure.
But lots of people selling like prebiotics now too.
They are. So I guess it's okay. I mean, for me, for the average person who's not working on any kind of health issue, then I would say take it from your food and sauerkraut and fermented food and fiber and all this, because it will give you a lot of whole food effects as well, and it will give you all the other nutrients too. And it reduces pill burden because you don't want to take so many pills and you start to feel ill. But with people who I'm working with intestinal bacterial overgrowth or IBS or autoimmune issues, then yeah, we use probiotics and prebiotics very therapeutically as well, according to the latest research, which I tell you is changing every single minute. So yeah, usually in those cases, I would seek my mentors who are at the top of their game in research, and I would be asking them. And at the moment, we actually agree we don't know an awful lot. Yes. So a lot of things that you see on the shelf is probably not really been that validated. Yeah,
I know. It's business as usual, right?
Yeah, right. Yeah.
So just one last question before I let you go. Okay, this is the interesting one. So probably will be linked to the previous, the earlier topic that you were talking about, but it really depends. You might not want to answer that. The last question, just let your imagination run wild. If you were the Minister of Health, actually, I don't know who it is right now. There's no limit and you have all the resources. What would you change or implement in Singapore? The one thing you would love to change, yes.
In a strange way, I'm already doing the work. If it, the really.
But now you can do it from the top-down approach.
We talked about the ground-up approach of education and sensible medicine and the awareness of our food and environment with our health. I think that is like really the number one change that I would love to see in everybody's health education background. So you've come from an education background, and I think you can understand that actually it starts from educating
the schools,
the schools and really the youngest, most malleable minds, because by the time they graduate, and a lot of doctors as well, they graduate, their minds are already fixed. And they might find it a little bit more difficult to change. So health awareness, the awareness of the interplay between the ecosystem and our health as well, I think it's going to then lead to a lot of people who come out of the education system doing this great work.
Yes.
But I think that we have a really great medical system. I don't fault it at all for the emergencies. So yeah, I think that's just it really. And also for more and more people to realize that it's not just about the medical system, but also the health, not about the system that takes care of you when you're sick, but also realizing that we are responsible for building up our own health and what that actually means: mental health, ecology, food sources, and this and that, and the better understanding. So I think education, I've kind of like swapped and say, oh, actually I prefer to like work with the education, and that's actually what
I know. Yeah. So I've got lots of stories when I was a teacher. Things to do with food in the canteen and stuff like that.
Yeah, like, to be honest, why I'm so passionate about the environment as well really started was like a 12-year-old when I was doing social studies, I think. It's and we had some projects in school, and that's just really stuck with me.
Yes.
Yeah.
All right. Exactly. Absolutely. So yeah. Okay. So the change would be to start from the schools and start teaching the young minds and start molding them.
All about education.
Getting the teachers involved.
Yeah.
So that we nurture the next generation of healthy eaters and active individuals. All right. I think that's a great place to end.
Thank you so much, Karine, for having me.
Thank you so much for sharing your experiences and insights.
All right. We'll talk later.
Yes.